So where should we market to? So this particular section is talking about where I want you to start marketing your products and services. And these are very great information that you should start taking notes down, okay? So I want to be able to ask this. Tell me how you are marketing right now. I want to know how you guys are marketing right now. What you guys can do is this. Later on, create a quick short video right now about how you're marketing. What are you doing? Give me a 30-second speech, a 30-second USP, or a elevator pitch. And then send that to me. And then send another video telling me, now that you watch our program, this is what you're going to be doing next. I want to see your outlook on where you want to go and how you want to take things to the next level. Sometimes when I have our live events, I will have people come up and grab the mic and tell me how they currently are marketing, how they present themselves. And just within a snap, we can kind of adjust it and make it and improve it even better. So what are the current techniques right now that are being used? What are the current techniques of marketing? Just a typical drop off the brochures, a spaghetti type marketing. I'm going to send you a postcard. I'm going to go ahead and drop off and bring a full spread of lunches. Those are the typical current techniques, right? Now, here are the current trends though. Before we can learn the new things, let's talk about the current style of marketing. And I hope to get those videos from you guys so I can actually help you out even further. So some of the current trends that are going right now is people are going to senior fairs. Okay, if you haven't planned to go to a senior fair or haven't been to one, I suggest that you find out the nearest or the closest time of a senior fair in your area. Other people have their independent marketers. Some home health agencies, home care companies are doing health screenings in public. Some agencies are even taking care of their own employees as patients. And also there are some agencies, unfortunately, that are paying per patient. And this right here, ladies and gentlemen, I want you to be able to make sure you look up the Starks law, you look up the anti-kickback laws on why it is not advised to be doing these things. And I'll discuss a few things about that later on with you guys. And we actually have a full course just on the anti-kickback and Starks law that I suggest you guys watch. So some of these current trends, are good to do. Some of them will go to the nursing homes, will go to the hospitals, will go to the assisted living communities. These are great trends. Great trends. But the thing though is, how do we improve upon it? Can we improve upon it? Of course we can. And the next thing to ask is, do you maximize your marketing? If you're an agency that is existing already, do you maximize the most out of it? Do you have a referral close technique? Like for example, when we speak to a physician, before we even start a presentation, I ask them this. I said, doctor, before I even get started, because I'm absolutely going to know that you're going to enjoy our services, do you know any other physicians that would love to be able to hear more about our services and how it can improve their patients? That's what we call the referral close. Before we even start a presentation, I'm so confident enough, I'm going to ask for a referral. The doctor can say two things, yes and no. If they say no, great, let me go ahead and get started with this whole presentation. Then you can repeat that question later on. If a physician says, well, yeah, I do know, well, doctor, give me the person's name. I repeat this so many times, this referral close, because it's important to know and use. Another thing is, do you know your results? Do you actually monitor your return on investment? Do you actually have A and B presentation monitoring, meaning that you try the same presentation one way and adjust it a different way again, but it's the same outcome? And do you actually go ahead and monitor to see what the results are, the return on investment? If you give a particular pen, if you give a particular cookie or a particular trinket, do you know your results? Some agencies have marketers and they don't even know the results that they have. And 6 months, 9 months later, they realize I spent close to $50,000 and they only brought me 6 patients. Now, that is a lost money. You need to be able to know what you're spending on a monthly basis. Henceforth, you have to have your budget. You also have to have your expectations of your marketers as well. Do you have a policy and procedure for marketing? I said this earlier, you need to create a policy and procedure for marketing where literally anyone can walk in and start marketing for you. And the reason why I say that is because there's going to be times where your marketer is going to move on and move to another company, get a better offer. And you need to be able to expect that can happen. And when that happens, can you bring somebody off the street and literally give them the policy and procedures and tell them and give them a quick in-service so that they can start marketing automatically? Just like when you hire your caregivers, you give them an initial training. When you hire nurses, you give them an initial training. Do you have training for your marketing team? And I'm glad that you actually are watching this video, because this video is what it is. This is our basic home health marketing program. Crazy amount of information that should be shared with any new person in a company, that should be shared with your DONs, that should be shared with administrators, with supervisors, even with the field team as well, so that everybody gets everything in their head. What the company wants is success. The next thing I want you guys to understand and learn is this. When you're marketing your company out there, you will have to be great at storytelling. Because storytelling is so amazing on how to be able to impact somebody's feelings to want to actually use a product. If you guys start seeing nowadays in a lot of marketing campaigns of a lot of different companies, not even in the healthcare industry, they tell a story about a patient, about a physician who enjoys their services and what the company has done for them. Okay? The stories compel people to change the way we feel, the way we think, the way we act, the way we behave. Can you tell a great story? So, literally, if a picture is worth 100 words, then a metaphor is worth 1,000 pictures. So if you can paint that picture for them. Doctor, let me tell you something about a time that a patient was having problems with their current home health agency. Their physician actually gave us a call and said, Michael, we need some help with this patient. This patient keeps on going into the hospital. We're having some readmission problems. The hospital is on my back. What do I do next? And what we did is we told the doctor, I said, okay, what we can do is we can get started with this patient with a telehealth program where we can monitor their vital signs, their O2 sats. Now the patient's a CHF patient, so we also monitor their weight. And because of that, we were able to find out what's going on with the patient. And another thing, doctors, what we did for the patient was this. We also brought in their family and we provided them education. We provided them an in-service because they're there more with the patient. They're there with the patient full time compared to our staff in home health where we only can be there once or twice a week. What we're able to do is we're able to educate the patient, the family, and ultimately what ended up happening was this patient felt better and was able to literally stay home longer. Now, eventually, doctor, we figured out that the patient was going to require long-term care. And so with that determination, we worked with the family member to ultimately be able to find them a good nursing home that they would feel comfortable in. Because that's what we do, doctor. We transition patients. If we know the patient needs more service, we're not going to keep them in the home health care. We know and we monitor these patients to make sure that they get the best care that they can actually get, whether it's from us or from another company. My goal is to be able to work with you, doctor, so ultimately you're going to be able to see that you're going to want to work with us because that's what we do is we're in the business of caring for people, and that's why we're here. So do you see how that story goes if you told that to a physician? How you're able to help them? Okay, everyone, so this is the biggest question that literally all home health agencies, all home care companies, all hospice companies as well will be asking on a daily basis. And if you're not asking this on a daily basis, you should. Where do we get patients? Where do we get clients? Where do we get referrals? It's the biggest question to be able to ask, to be able to succeed as a agency, as a home health, as a home care, as a hospice agency. Because for you to succeed, you must find patients, you must find clients, you must find referral sources who are willing to give you leads for patients and clients. So one thing you need to be asked is this, is to be able to determine is how many new potential clients have you visited this week? And so when we're talking about clients, we're talking about either referral sources, or if for home care, are you doing a lot of marketing in the field out there and talking to multiple potential clients? So let's say, for example, you're a new home health agency and you are just getting started. How many people do you need to visit on a weekly basis to be able to have a successful company? Do you have something in mind? Write that down and I will share with you later on what I believe and what I've seen in the past on what is the right way and how many potential people you should be seeking out on a weekly basis. So how many in a week? The next question is how many in the past month? How many in the past quarter of the year? I've spoken to a lot of home health agencies who have told me that, Michael, we are struggling right now. I am the jack of all trades, yet we're not getting referrals. What should be my next move? What should be the next thing that I should start offering? What type of services? How do I improve it? Should I spend money on internet marketing? Should I spend money on pay-per-clicks? Should I spend or invest money into a new website? And when we start the assessment, one of the biggest questions we will ask a company is, how many marketers do you have working for you? Out of those marketers, how many times a week are they going out? Out of the how many times they're going out in a week, how many people do they actually see? How many people do they cold call in a week? And those are new people, of course. The next question is, how many times do you actually go back to your current referral sources? Or how many times have you gone back to people that you already marketed to? So those are good questions to be able to ask, and you should be able to know the answers to this. If you were asked this question out of the blue, you should be able to have that answer because you should know what the expectations are. So where? The greatest number of referrals for home care comes from understanding where to go first, how to prioritize the list, how to identify the best targets for best referrals is literally the key to starting a successful marketing and sales process. You don't want to just go ahead and open the white pages or the yellow pages, flip through the pages by not looking and point to a page and say, I am going here. You want to be able to make sure that whoever you're speaking to does have referrals of patients that you can service. And going into something blindly, you will expect defeat. And one thing that you need to do is you need to plan things out. You need to be able to understand who are the people that are actually referring patients. Who are the actual players in the game that you can link yourself up to? Who's going to be able to help you get referrals or point you to other referral sources? These are taken or received by attending your networking events. Are you meeting people who are in your industry who are targeting the same people yet providing different services? At the end of this particular section, what's going to happen is this. You're going to be able to identify the agencies ideal for clients. You're going to be able to understand how to target and reach referral sources for your agency. And you're going to have the basic understanding for the best home care marketing strategies and tactics. So let me share with you guys a quick bonus tip. You want to always be able to set your intention when you're speaking to someone, when you're starting a conversation. So when you are in front of somebody, when you are about to have a presentation, or when you just met them, set your intentions for this. Just as I set the intentions on this particular section where I told you in the end you're going to learn this. So my tip for you guys is when you're having your initial meet with someone, tell them your intention, why you're there, why you want to speak to them. Look, my goal is to get your parents on our services and begin getting the care they need by, set the date, by tomorrow, by today. Okay? So you're creating that story. Remember, I'm telling you guys a story. So you're going to future tense a story that you're going to be taking care of their parents. If you're speaking to a doctor, doctor, listen, my goal is to get your patients on our services before they even get discharged to their homes. We will begin taking care of you now and take great care of your patients so that they will not go back to the hospital. If you are not able to see the future, then you're not going to be able to predict what you want. You want to be able to create stories of the past, of what is going to be happening in the future. That is literally some of the best important tips to be able to help you guys create your presentation. And it's very important for you as a marketer, for you as an owner of a company, for you as a director of nursing or administrator. It's very important. And what you're going to be learning with these marketing techniques is you can actually use these with your own employees. Who are the best targets? Well, let's start talking about them right now, okay? So who are the best targets? Well, literally some of the best targets for referrals are going to be your discharge planners at hospitals. These are the people that you want to be able to link up. Now, it's a lot harder to be able to get into the hospital system, but that does not mean it is not possible. It's just going to take a lot of follow-ups. And I'll discuss with that to you guys a little bit later on further. Don't forget the physician offices. Look, you have your physicians taking care of patients that are in the hospital. And then at the same time as you're going to be dealing with physicians who are taking care of people at nursing homes. You also have the primary care physicians who have their offices where they have patients that are visiting them. So you have a large flow of patients coming from these locations. So you definitely want to be able to have a plan on how to market to these particular facilities. Rehab centers. These are like your CNCs, your continuing, services, or your nursing homes pretty much, or your rehabilitation centers, also known as rehab centers. So typically in a rehab center, there's two sections. You have your long-term and you have your short-term. The short-term area are those Medicare patients or Medicare Advantage patients or even some private insurances where they are not able to go directly to home from the hospital. So normally they will be in the nursing home or the rehab center for a small amount of time because they still need some assistance. But even once they have actually used up their time at this rehab center, they're eventually going to have to go home because their insurances, like Medicare, is not going to cover them there to be there entirely for a long period of time. So when they go home, which these facilities will always have discharges, especially if they're a larger facility, you're looking at about sometime in an average of about 3 to about 10 discharges on a weekly basis, depending on how large they are. So your rehab centers are a lot easier to get into rather than the hospitals. So you want to be able to concentrate majority of your time on your marketing for the home health services, for your medical home health services to the physician offices and also to the rehab centers. These are some of the best targets that you have. Also talk about hospice providers as well. If you are, let's say, a medical home health agency, there are times where hospice patients graduates from their services where they actually are not needing any more hospice services, but may need home health medical services. where they get downgraded from hospice care. Also, if you are a home care agency, the hospice companies will typically need assistance from home care agencies because they cannot provide all the clinical or all the clinicians for those particular patients that are going to be needing 24-hour care, that's going to be needing 12-hour services. So it's a very good source for both home care and home health services. I talked about the rehab centers, but the skilled nursing facilities are also considered rehab centers. There are some skilled nursing facilities that don't have rehab sections on them. So you want to be able to look at both locations. You also have Medicare agencies. So this is for non-medical private duty companies. So what's going to happen is this. When you are actually a non-Medicare home care agency, you should be able to link up with home health agencies that are medical. Because at times is for the medical home health agencies, they can only send nurses, therapists at a short period of time for 1-hour visits 1 to 2 times a week. There are going to be some patients that may need 24-hour care, and they, most of the time, the medical home health agencies do not have non-medical private duty. For some reason, they look at this as something that they're not interested in. There's very few of them that actually offer both. And for you non-medical home care companies, be happy about it, because this is a good section, a good source for you to be able to get more clients. Now, if you are a medical approved home health agency, I would consider making sure that you go ahead and bring in a private duty section of your organization. You can go ahead and create it as a separate entity. Make sure that there are separate people working on the locations, because you don't want them to mix their ideas up together. You want to be able to create that separation between both agencies. But at the same time as you want to be able to utilize and start offering these type of services as well. Later on, I will also discuss great sources for private duty referrals as we go along with this presentation. So here is a good question. If you cannot answer any of these, then it's going to be hard. Do you know how to help them? Do you have an inroad? Do you know what makes their jobs easier? What ways are your services benefiting to them? Why would they just have to know about your agency? You need to be able to answer these questions, because what your job is as a home health agency, as a home care company, is not to provide services. You're here to solve problems. Our business is solving problems, whether the problem of patients having to be readmitted back to the hospitals, that being a problem and we can actually solve it by reducing that, or the problem of physicians not being able to find a great home care company, you're going to solve that problem. Maybe the physician doesn't like how other home health agencies are communicating with them. Can you provide better communication? So do you know how to help them with their problems? Do you have an inroad, a way to be able to access them, to get there? Do you know what makes their job easier? We're going to talk about later on about CPOs, also known as care plan oversights for physicians. Can you help them with those? What ways are your services benefiting them? Look, you have to look at it as that any of your services is benefiting them because you're caring for their clients. So you need to be able to look at these questions, write it down, and for each great potential referral source, like we talked a few slides back, to be able to list down 4 to 5 problems that you can solve for them. By doing this, you want to go ahead and create your presentation around those problems. So understand this, we are in the business of solving problems, not creating problems, solving problems, not just providing services. So have you ever researched the best referral targets outside the healthcare continuum? Other than what we've discussed, there are other potential resources than the nursing homes, than the hospitals, okay, than the skilled nursing facilities, than the medical approved home health agencies. So outside the healthcare continuum, there's a potential to get more clients from other people. So when we talk about do you have an inroad, you need to be able to find out and maybe look into financial advisors, attorneys, CPAs. Are you marketing to these particular areas like country clubs, book clubs, senior groups, Rotary clubs, homeowner associations, condo associations, disease associations? These are good places to really be able to get the word out about your organization and to be able to find people who are going to be potentially your clients. So let's create a profile of your clients. What type of people are you planning to actually service? You want to be able to sometimes look at your geographical area. You can use the Census Bureau. You can actually look at geographically, who's in your area, how many seniors over the age of 65. There's programs that you can actually use. There's actually services that can also look that up for you. You want to be able to do that because you can actually target those people directly, especially if you're doing mailers. I truly suggest you can do that as well. Another thing also is, what type of diseases are the ones that you want to actually care for? What are the common diseases that you're going to be targeting directly? And the reason why I ask that is because, let's say, for example, you're dealing with a lot of ortho patients. So you're going to be targeting ortho physicians directly. Are you dealing with neurologic problems? Then you're going to be dealing with neurologists. So by being able to look at what's the geography of the clients that you want to be able to service, what is the number average of services that they're needing? Where do you get your clients? Can you add other sources of income? What are the payer sources? Do you accept wound clients? Can you handle high-tech clients? When we're talking about high-tech clients, are your nurses trained to provide IV antibiotics, IV hydration? Do you have oncology-trained nurses who can provide chemotherapy as well at home? We need to first understand what services we can provide. Because if your nurses are not wound certified nurses, your nurses are not trained with wound vacs and how to provide, treatment to patients, then that may cause risk for your patients. And at the same time is the physicians may be upset at you if you're not able to care for the patient correctly. So before you actually start working out there, you don't want to just accept any patients if you cannot actually provide services for them, okay? So if you cannot find services for them, you need to be able to learn how to be able to target them. It's very important for you to do that. So look, I know what you will say in the end. I already marketed it to them. The question is, all of them? And the reason why I ask this is that this is for people who are already established home health agencies. And I discussed with you guys on who you need to target, who you need to market to. And most of the time is I'll hear people say, well, I already did that. Then I ask this question is, did you do it to all of them? Did you reach out to all the physicians? Did you reach out to all the nursing homes, all the skilled nursing, all the potential referral sources? And when I asked that, I asked them how many times? What did you do to reach out to them? Who did you meet with? When was the last time you saw them? Why did you meet them? And the reason why I ask this question is, well, you'll never visit all of them, because imagine how many physicians are out there. You're never going to fully be able to visit all the nursing homes. And if you have, what did you do? What did you do when you met with them? Did you have a plan on how to speak to them? Did you hand them something that is of value to them? And the question is, sometimes when you go over there, you do the spaghetti style marketing, you don't meet the right person. You never really had them in front of you. And so it's valuable to be able to meet with the right person. If you go to an assisted living community, for example, you want to deal with the administrator. If you go to a skilled nursing facility, guaranteed you want to deal with the discharge planner. If you go to the doctor's office, you may not need to talk to the doctor directly. You might just have to work with the office manager. So it is very valuable to be actually meeting the people that you should meet, the people that makes the decision at the facility that you go to. And when I ask when was the last time, do you guys have a follow-up system? Typically, most home health agency marketers will visit a particular person and they do the presentation, and then they think that they did a great job and that they're going to start getting referrals. Yet a month passes by, 2 months passes by, and yet there's no referrals. Well, it's because it's your follow-up. You need to be able to follow up these people at least once a week. And if you can't visit them, they need to receive a phone call from you. And if they receive a phone call or a visit from you, they should receive a fax, an email from you. And if not a fax and an email, did they receive something by snail mail? You need to be able to have continual follow-up with these people so that you remain top of mind. And the next thing is, why did you meet them? When you did that visit, did you just want to introduce yourself? If you followed up, did you go ahead and bring another educational item for them? You need to be able to have and create reasons why you met with them and do it continually. Another thing is, where did you meet them? Did you meet them in their office? Did you have lunch with them? Did you meet with them in the hallway? Did you meet them in another facility? Did you meet them in a networking event? Because each one of those is important to know to be able to create the right follow-up.